miles and my highest weight was 123 kilos. And I just thought, this has got to stop.
As a nation, we're fatter than we've ever been. Some of us are turning to medical procedures to help us lose the weight. And many who do say it's the best thing they've ever done.
Every week I slowly lost weight.
But how we're paying for those procedures could be impacting our lives well into retirement.
You are decreasing the lifestyle you have in your retirement.
Medicine and money should never be mixed.
Our waistlines are rapidly expanding. Back in 1995, our obesity rate was 19%. Today, it's 28%. That's more than a quarter of our population. Thousands of Australians each year seek help from gastric banding surgery, and more of them are dipping into their superannuation to do so.
Struggled with my weight my whole life. I grew up in family takeaway business, so I didn't have a very good relationship with food.
When Joanna Metzikas hit 30, her life was at a crossroads. She'd battled morbid obesity since her teens and now had high blood pressure and lower back problems. And while she couldn't afford to pay for gastric sleeve surgery, she decided to withdraw half of her superannuation. All up, $25,000 to cover the cost.
I made a decision I didn't want to wait, and that was the quickest and best way for me.
Did you take into consideration what impact it might have had later on in life?
Not really. I just thought that I want to live to be able to use that money, and I might not if I don't do it now.
Joanna says she couldn't put a price on her new life post-surgery.
I started at 128 kilos. My last weight's 73, so I've essentially halved my body weight.
Walking up the stairs was a difficult thing that never used to bother me at all.
18 months after Joanna's surgery, her friend Jade Mirovic underwent the same procedure. She'd signed up to private health insurance to cover the bulk of the costs. And once her 1-year waiting period had passed, she withdrew $10,000 from her superannuation.
So I've lost 27 kilos. I'm more driven to want to do it because I know I have that little bit extra assistance. So I've gone through this surgery, why would I just waste it? Let's go do this.
They need to really understand the implications of drawing down on their superannuation.
Ben Sharman is the head of policy and government relations at the Financial Planning Institute of Australia.
So for somebody in their 40s, for every $10,000 they need to access, they're reducing their retirement benefits by $42,000. And for somebody who's in their 30s and looking at a 40 years till retirement, $10,000 will decrease by $180,000.
The percentage increase of the number of patients that we have seen who have started dipping into their super funds to facilitate weight loss surgery has gone up from 7% in 2010 to almost 35% in 2016-17. And I think that is a significant jump.
That's a 5-fold increase, according to Dr. Arun Dhir, a bariatric surgeon and a director at Melbourne Gastro Surgery. He says gastric surgery is very effective, but any patient looking at undergoing weight loss surgery needs to show a good understanding of the risks involved and demonstrate commitment to lifelong changes before they proceed.
It's actually medical problems associated with obesity like diabetes, the risk of developing cancers, risk of developing heart problems. That is what these individuals are trying to address.
Dr. Dhir says he recently had a 65-year-old morbidly obese woman come in desperately seeking weight loss surgery, with $500,000 already sitting in her super fund.
She wants to get rid of this pain that she experiences day in and day out and wants to play and engage with her grandkids. Now, what sort of dollar amount do you want to put on to that experience? I say that there is no use of superannuation to a dead person.
The practice of raiding your super is becoming so popular that many clinics across the country are promoting it as a marketing tool. And it's not just weight loss that some clinics are spruiking. Some fertility clinics are also helping patients fund their IVF with super, and specific cosmetic procedures such as breast reductions and excess skin removal are also available.
People want to enjoy a superior quality of life now rather than after 65.
Well, a lot's changed since I lost weight. I'm a lot healthier. I love exercising. I can shop a little bit more than I could before. Met my partner, we've started life together. And just mental health as well, a lot better.
I've already paid that money back into my super, and if I didn't do it, I wouldn't be here to enjoy my super at the end of it.
The federal government is currently undertaking a review of the circumstances under which people should have access to their super ahead of retirement, and we'll find out the results of that review later this year. After the break,